Welcome to another nursing review on pharmacology. Before we begin, let's see if you can get this question correct. A patient reports that since cutting the grass 3 days ago, their shortness of breath has gotten worse. The patient has experienced asthma in the past. The nurse should give this client the following right away, since they are experiencing a significant exacerbation. High doses of inhaled short-acting beta-2 agonists, intravenous fluids, oxygen, or systemic corticosteroids. Put your answer in the comment box below. Now back to the lesson. This lesson will focus on antiasthmatics. We will first learn about the actions of this medication, adverse reactions, and contraindications. Antiasthmatics are typically used as maintenance therapy for asthma. Let's talk about how it functions now. Antiasthmatics activate beta-2 adrenergic receptors in the smooth muscle. Beta-2 adrenergic agonists raise cyclic adenosine monophosphate levels, which causes bronchodilation. Corticosteroids prevent eosinophil recruitment, the release of other inflammatory mediators, and the synthesis of cytokines, leukotrienes, and prostaglandins. Glucocorticoids inhibit immunological and hypersensitive reactions. Antibodies that disrupt leukotriene receptor interaction prevent leukotriene from functioning by preventing it from connecting with its receptor. Okay, now let's move on and learn about adverse reactions, which are headache, pharyngitis, upper respiratory tract infection, cough, rash, dry throat, and abdominal pain. Okay, this is important. Let's now learn about contraindications of this medication group. Fluticasone, propionate, and salmeterol inhalation powder are contraindicated for use as the main treatments for status asthmaticus or other acute asthmatic episodes. When a patient is transitioning from a systemic to an inhaled corticosteroid, has active or dormant tuberculosis, untreated systemic infections, ocular herpes simplex, or immunosuppression, use with caution. Patients who are at high risk for decreased bone mineral content include those with a family history of osteoporosis, prolonged immobilization, or long-term use of medications that reduce bone mass. Let's now focus on the commonly used medications of this class, starting with fluticasone propionate and salmeterol inhalation powder. These two medications are used to treat long-term maintenance of asthma. These medications are also used for maintenance therapy for airflow obstruction in patients with COPD from chronic bronchitis, and also to reduce exacerbations of COPD in patients with a history of exacerbations. Fluticasone is a synthetic corticosteroid that works specifically as an anti-inflammatory agent. Salmeterol Xenophote, a long-acting beta agonist, which relaxes bronchial smooth muscle and inhibits release of mediators. Side effects are the following. With the central nervous system, side effects are headache. ENT side effects are pharyngitis, hoarseness, or dysphonia. For the gastrointestinal system, side effects are diarrhea, nausea, oral discomfort and pain, oral candidiasis, unusual taste, vomiting. Musculoskeletal side effects are arthralgia, muscle pain. Respiratory side effects are upper respiratory tract infection. Other side effects are allergic reactions, viral or bacterial infections. Okay, excellent. Now let's learn about nursing actions, which is closely monitor children for growth suppression. Patient education follows nursing interventions. The patient should be taught the following points. Advise the patient not to wash the mouthpiece or other components of the dry powder multidose inhaler and to store it in a dry location away from heat sources and sunlight. To avoid oral candidiasis, advise the patient to rinse their mouth after inhaling. Tell the patient that while they may feel better 30 minutes after taking the dose, they may not get the full benefits for at least a week. Remind the patient not to take more medication than is prescribed. Advise the patient not to use Advair to treat acute symptoms. Use a short-acting beta-2 agonist that is breathed to treat acute symptoms. Mometasone furoate, mometasone furoate monohydrate. This medication is used to treat asthma, allergic rhinitis, and nasal polyps. The way this medication works specifically is that it inhibits many cells and mediators involved in inflammation and the asthmatic response. Side effects are the following. With the central nervous system, side effects are headache, depression, fatigue, insomnia, and pain. ENT side effects are allergic rhinitis and pharyngitis. Gastrointestinal side effects are dyspepsia, flatulence, nausea, oral candidiasis, and vomiting. Respiratory side effects are upper respiratory tract infection and respiratory disorder. Other side effects include flu-like symptoms and infection. Let's check out the nursing actions for this drug. In patients who are at high risk for decreased bone mineral content, use with caution. Examples of those with decreased bone mineral content are patients with prolonged immobilization. Also observe the results of lung function testing, and note that immune suppression, glaucoma, and localized mouth infections should be monitored. With nursing actions comes patient education. Here are some points to teach the patient. Teach the patient how to use the inhaler or nasal spray pump correctly and to take care of it on a regular basis. Advise the patient to take the medication consistently and at the same time every day. Tell him to use it in the evening if he only uses it once a day. Advise the patient not to take medication to treat a bronchospasm or asthma episode right away. Advise the patient not to come into contact with measles or chickenpox and to let the prescriber know if they do. Inhaled corticosteroid use over an extended period of time may raise the risk of cataracts or glaucoma. Advise patients to report any changes in their vision. Montelukast sodium. This medication is used to treat asthma, seasonal allergic rhinitis, perennial allergic rhinitis. It is also used for prevention of exercise-induced bronchospasm. In particular, this drug lessens both early and late-phase bronchoconstriction brought on by antigen exposure. Side effects are the following. With the central nervous system, side effects are headache, asthenia, dizziness, fatigue, fever. ENT side effects are dental pain, nasal congestion. Gastrointestinal side effects are abdominal pain, dyspepsia, infectious gastroenteritis. Genitourinary side effects are pyuria. Hematologic side effects are systemic eosinophilia. Respiratory is cough. Other side effects include influenza. Okay, excellent. Now let's learn about nursing actions for this medication. Mix oral granules with a spoonful of cold or room temperature soft meals and administer them straight into the mouth. Disregard food when administering oral granules. Here are some things to teach the patient about this medication. Tell the caregiver that the kid can take the oral granules straight into their mouth, dissolve them in 1 teaspoon of cold or room temperature breast milk or baby formula, or mix them with a spoonful of rice, ice cream, applesauce, or carrots. Instruct the caregiver to hold off on opening the packet until it is time to use it and to provide the entire dosage within 15 minutes of opening it. Inform her that if she is combining the medication with meals, she should throw away any unused portion and not save any extra for later use. Encourage the patient to take the medication every day, even if they are asymptomatic, and to get in touch with their doctor if their asthma isn't under control. Encourage a patient who has a history of aspirin sensitivity to refrain from taking aspirin and NSAIDs during drug therapy. Let's go back to that question we had in the beginning of the video. A patient reports that since cutting the grass 3 days ago, their shortness of breath has gotten worse. The patient has experienced asthma in the past. The nurse should give this client the following right away since they are experiencing a significant exacerbation. High doses of inhaled short-acting beta-2 agonists, intravenous fluids, oxygen, systemic corticosteroids. The correct answer is oxygen. Due to the potentially fatal nature of severe asthma flare-ups, treatment should begin as soon as the flare-up is identified. Oxygen should be administered immediately to any client experiencing a severe exacerbation. Secondary therapies include systemic corticosteroids and high dosages of inhaled short-acting beta-2 agonists. Since asphyxia frequently results in death, oxygen therapy is crucial. When asthma flares up, intravenous fluids should not be administered. Did you get it correct? Alright, well, that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.